Given that mcas has roughly the same prevalence as diabetes in our populations, why has it been so ignored by the medical profession?
Well, I think it goes back to what was saying before, and something you and I were talking about before we started. We are trained to think in organ systems. All right. So cardiac, pulmonary, renal, gastrointestinal, it basically creates a kind of silo thinking. And then what's happened, certainly in the US, that has exploded into all these specialties and subspecialties. So these days, you go to a primary care and you complain of coughing, they were likely going to refer you to pulmonary or, chest pain to cardiac. And so if you have somebody who walks in and says, well, actually, I have chest pain, I have coughing, and my joints hurt, and I have rashes and headaches, and I can't think straight, I'm brain foggy, that doctor's going to not know what to do with you because they're trained to think in separate organ systems and what I keep calling silo thinking. And it's very sad. And internal medicine training used to be full body training, not silo, and that's just changed. And that's part of the problem. And we, doctors like yourself and me and all of our colleagues who are in this working with long COVID and MCAS, et cetera, need to do everything we can to try to have doctors broaden their view, pull back to wide angle lens, not the telephoto lens. That's very difficult because of the training. It's difficult in our country because of our messed up healthcare system where you're only allowed to see a patient for 10 minutes if you work in a hospital clinic, that kind of thing. I think that's what has to change.